Alright, pathologists, so we're going to look at non-infectious diseases and the broad range of them. Now, this is going to be a very brief overview with a little bit for you to do at the end, not too much, okay? So, non-infectious diseases essentially mean they can't be passed from one person to the next directly, okay? So, we'll start with genetic diseases. So these are diseases that you can either inherit, so things like cystic fibrosis, or there can be mutations that occur, so damage to the genes, and that's stuff like your cancers, largely. Now, we'll go around like this. So this brings us to our circulatory, oh, by the way, diabetes is also in part a genetic disease. So then we come to our circulatory system, alright, so that's the heart. This is the largest killer in all of Australia. I think most of the developed world, it tends to be the circulatory system, which is the largest killer. So there's a few different types here. You can have blood pressure, high or low. You can have a thrombosis, which is a blockage of the vein. You can have coronary heart disease, which is what often leads to heart attacks. And these can also be genetic diseases. Now, then we come to mental illness. Often we're looking at depression, OCD. The most common one, well, not the most common one, but the one we hear about most are the eating disorders. Now, this actually brings us into our next one, because the eating disorders, while they are a mental disease, they are affected by diet. So when we come to our diet diseases, there is malnutrition, and this can be not enough energy in our food or not enough micronutrients, so stuff like scurvy, whatnot, so due to lack of vitamin C, obesity, and again, eating disorders. So what I want you to do, that's our very brief one. Now I want you to rule out this table, and for each of those types of diseases, I want you to minimum, so if you want to extend yourself and do a few more, feel free, but minimum 2 of each type. So you give the name, for example. So depression doesn't count. You have to do an extra 2 on top of this for mental illness. So depression, it is a mental illness, and the effect. So I guess it's symptoms and long-term effect. I would add potential for suicide at the end of that as well. So overwhelming sadness, lack of motivation, potential for suicide. And yeah, that's what we're doing. And I want you to have that completed before you come back. Top work. Alright, I'll see you later.